Welcome to Fluvoxamine Frontiers, Battling COVID-19, a podcast where we dive into the science, stories, and surprises behind an unlikely drug in the fight against a global pandemic. I'm your host, Dr. Soma Rohatgi, and joining me is the brilliant researcher Saakshi Sharma. Today, we are starting off our 20 episode journey by exploring how fluvoxamine, a drug typically used for mental health, became a contender in treating COVID 19. Let's start with a quick science primer. Imagine your body as a busy city, and inflammation is like a wildfire spreading through it during COVID 19. Fluvoxamine, an SSRI, is known for calming the mind by balancing serotonin, a chemical messenger. But here's the twist: it might also act as a fire extinguisher, dampening that inflammatory blaze in the body. How does a brain drug pull off this double duty? Let's find out. Saakshi, let's dive in. Fluvoxamine was originally described and designed for conditions like depression and OCD. What actually sparked the idea to repurpose it for COVID 19, and what early evidence support this leap?
Great question, Dr. Soma. The story begins with the desperate search for treatments during the early days of the pandemic. Researchers were looking at existing drugs to avoid the long timeline of developing new ones. Fluvoxamine caught attention because of its unique properties beyond serotonin regulation. It interacts with a protein called the sigma-1 receptor, which plays a role in inflammation. In COVID-19, the virus can trigger a cytokine storm, a dangerous overreaction of the immune system. Early studies, like one from Washington University in 2020, showed that fluvoxamine could reduce severe outcomes in outpatients. In a small trial, patients on fluvoxamine were less likely to need hospitalizations in comparison to those on placebo. The hypothesis was that its anti-inflammatory effects were calming the storm, giving the body a chance to fight the virus more effectively.
That's fascinating. A mental health drug stepping into a viral battlefield. Can you break down how fluvoxamine interaction with a sigma 1 receptor might help in COVID 19? Is it really like taming the cytokine storm, or is there more to the story?
Absolutely. The sigma-1 receptor is like a traffic controller inside cells, regulating stress responses and inflammation. In COVID-19, the virus causes chaos like cars piling up in a traffic jam, leading to that cytokine storm. Fluvoxamine binds to this receptor, helping to restore order by reducing the release of pro-inflammatory cytokines. But it's not just that. Fluvoxamine also affects platelet activity and endothelial function, which might prevent blood clots, another major issue in severe COVID-19. Studies like the Together trial showed a significant reduction in hospitalizations, suggesting it's not just about inflammation, but a broader stabilization of the body's response.
Thank you, Saakshi. So it appears like fluvoxamine is just not putting out the fire, but is also clearing the roads for smoother traffic. What are skeptics in the scientific community about using an SSRI for a viral infection? And more importantly, how did researchers address these doubts?
Oh, there were plenty of raised eyebrows, I must say. SSRIs are psychiatric drugs, so proposing one for a respiratory virus seemed like a stretch. Critics worried about its side effects like nausea or drowsiness and questioned whether the early data was robust enough. Researchers countered this by designing rigorous trials, like randomized control studies, to test fluvoxamine's efficacy. The Together trial, for instance, was a game changer. showing a 32% reduction in hospitalizations in high risk patients. They also leaned on mechanistic studies to explain how sigma 1 receptor modulation works, bridging the gap between psychiatry and immunology. It wasn't easy, but the data started to speak for itself.
That's the beauty of science, turning skepticism into evidence. Picture Fluvoxamine as an unassuming librarian who spent years organizing books in the quiet stacks of the mental health treatment. Suddenly, a wildfire, like the COVID-19 pandemic, threatens the entire city. This librarian then steps out, armed not just with knowledge, but with a hidden talent for firefighting, helping to calm the chaos. That's Fluvoxamine's story in COVID 19, an unexpected hero rising to the challenge. Thank you, Saakshi, for illuminating this incredible journey. Listeners, join us next time as we continue exploring fluvoxamine's role in the fight against COVID 19. Keep curious because science always has more surprises in store.